Welcome back to Psychology of Addiction. Now, along the lines of EFT, how exactly does that work? What procedures do you generally do to actually collapse a lot of those memories?
So what EFT is it's based on the idea that the acupressure system is essentially an acupoint is a small electrical factory. Electricity degrades over distance. So if the electricity or chi is going in a nice even direction in a particular meridian, which is a river of acupressure points, and there are 14 in the body, then we are as self-healing and as in balance as we can be. If those meridians become out of balance, then we experience some kind of dysfunction, usually of a physical and an emotional nature. So if with any kind of upset, either trauma or any kind of excessive appetite, our meridian is out of balance. With NET, which is called neuro-emotional technique, which is the one that I like best, you can actually muscle test which meridian is involved, and you can test what traumatic event is involved, and you can also discover the earliest trauma and then tap it out. So it's amazingly specific and effective. I think of it as if my computer is dead and I hire somebody to come out and diagnose it and fix it, it's a thing of beauty. EFT, or emotional freedom technique, is kind of like calling up a tech person and saying, how do I fix this? And they say, reboot the computer. So there isn't any diagnostics happening with EFT. You just tap every acupressure point you have, thinking about what the desire is, and it reestablishes homeostasis at that point, and so the desire goes away. Minute and a half.
Minute and a half.
Minute and a half.
That's incredible, just being able to just address and solve these issues so quickly, because usually a lot of the older therapies, and like a Carl Rogers person-centered therapy, you'd have sessions that would just go on for months before you would actually get to a core issue. But with this, minute and a half. And
wonderful stuff. Carl Rogers is great, and the attitude for therapy, I think, should definitely be client-centered. But again, you aren't getting to the deeper part of the brain and the body, and so you only get partial results. So if you aren't playing with all three of those brains, you're doing half-assed work, in my opinion. And that's what I would look at. The energy psychology, in my belief, is the most effective technique out there. But it isn't the only one. I would definitely still want to do talk therapy. I'd want to make sure that any kind of chemical disorder gets taken care of. I like the idea a lot of learning how to live within yourself. 12-step certainly does that. Karate, yoga, that sort of thing. But it's the same thing. It's learning to live within yourself and learning to have that balance. And if you're in there, you just don't have a whole lot of excessive desires.
It's true. It's all about the awareness and mindfulness of oneself and everything. Well, that's all for now, but join us next time and we'll be delving into more information.